Hello everyone. Today we are clearing up an important topic in pharmacokinetics, that is nonlinear pharmacokinetics. This is often asked in exams and is the key for understanding how drug behaves in our body. So let's break it down step by step. So first, what is linear pharmacokinetics using? It means that when we increase the dose, we increase or change the dose of the drug, the concentration in the plasma also increases in the same proportion, whether it's a single dose or multiple dose. The process like absorption, distribution, binding, metabolism, excretion, all the follows the first order kinetics, meaning the rate depends on how much drug is present. That's why okay that's why we say is dose dependent, because the pharmacokinetic parameters like bioavailability, absorption rate constant, elimination rate constant, volume of distribution, clearance remain unchanged even if the dose increases. Also, when we plot a graph, when we plot a graph, concentration versus time, all the curves for different doses will look similar and are superimposable. That's the sign of linear kinetics. In contrast, nonlinear pharmacokinetics means the dose and plasma concentration are not proportional. Why? Because certain processes like the body absorption, metabolism, excretion, depend on carriers or enzymes which have the limited capacity. So at higher doses they become saturated and the body cannot handle the extra drug in the same way. As a result, the drug may shift from the first order to zero order. The pharmacokinetic parameters change with the dose. We call this dose dependent, mixed order or capacity limited kinetics. Now, how to detect this non-linearity? To detect non-linearity, there are two simple methods. First one is determination of steady state of plasma concentration at different doses. Measure steady state plasma concentration at different doses. So if the concentration increases more than the dose, non-linearity exists. Then we have the second one where we have to check parameters. What parameters? Like bioavailability or half-life and clearance change with dose. If they do, it's a sign of non-linearity. Now we're talking about the causes of non-linearity or factors of non-linearity. Let's look at them. So non-linearity can occur in four ways: drug absorption, drug distribution, drug metabolism, drug excretion. Let's see the non-linearity in drug absorption. It can occur due to, first one is solubility issues. At high doses, drug reaches their solubility limit, forming a saturated solution in GI tract. Example, griseofulvin. Then we have the carrier mediated transport system. Carrier mediated absorption. Vitamins like riboflavin, folic acid, okay, cyanocobalamin use carriers. At high doses, the transporters get saturated, leading to non-linearity. Then third one, we have the saturation of pre-systemic, pre-systemic metabolism or gut wall or hepatic metabolism attains saturation. Some drugs like propranolol, verapamil and hydralazine undergo metabolism in gut wall. Okay, in gut wall they undergo the metabolism or before liver before reaching circulation. If these enzymes are saturated, bioavailability, bioavailability increases unexpectedly. Parameters affected are F means bioavailability, absorption rate constant, Cmax and AUC. Okay, decreases in case A and B and increases in case C. Okay, they are increases in third condition and they are decreases in first and second condition. Okay, so other causes of non-linearity in drug absorption are changes in gastric emptying time and GI blood flow and other physiological factors. Now we have the non-linearity in drug distribution. It is caused by saturation of binding sites. First we will see the plasma, plasma protein binding. Drugs like phenylbutazone and naproxen have limited binding sites. So when saturation is achieved, the free drug concentration will be increased. So as the free drug concentration increased, there will be two scenarios, either higher activity or the toxicity. Drug accumulation can cause the toxicity in the body. So this two can happen. Next we have the tissue binding. Okay, so drugs like thiopental and fentanyl may saturate storage sites in tissue at high doses. Okay, so in case of a plasma protein binding, plasma drug concentration increases and VD also increases. But in scenario B, tissue binding sites, plasma drug concentration increases but volume of distribution decreases. Then we have the non-linearity in drug metabolism. It can happen due to saturation, saturation of metabolizing enzymes. Example, alcohol, phenytoin, theophylline. Once enzymes are saturated, metabolism becomes zero order, which in turn leads to slower absorption. Okay. Then we have the enzyme induction. In enzyme induction, drugs like carbamazepine induce enzymes lowering plasma concentration over time. So saturation of enzymes results in decreased clearance, hepatic clearance. So increase CSS, reverse in enzyme induction. Okay, in enzyme induction, it will be reverse. But in case of enzyme cofactor saturation, the saturation of enzyme results in decreased clearance, so increased CSS. Non-linearity in excretion. Excretion can become non-linear when the active secretion is saturated. Active tubular secretion is saturated. Example, penicillin G. Clearance, clearance decreases when transporters are full. Saturation of carrier system. They are saturated. Transporters carrier system is saturated. So decreased clearance will be happen. Then we have the reabsorption is saturated. Active tubular reabsorption is saturated. Example like glucose, vitamins. Okay, when reabsorption transporters are full, okay, they are full, clearance increases, okay, because it is reabsorption. Okay, so reabsorption not take place, so they will be eliminated. Okay, cleared off from the body. Other causes: change in urine pH or nephrotoxicity, then forced diuresis, and binding site saturation in kidney can excrete. Non-linearity in drug excretion can causes. So that was non-linearity pharmacokinetics in simple terms. Okay, linear means dose dependent, non-linear means dose dependent saturable complex. Keep this in mind because it impacts everything from dosing schedules to drug safety. If you found this useful, like and share this video with your pharmacy friends, and don't forget to subscribe for more pharmacy content. Thanks for watching.